What are some natural ways to treat arthritis?
Looking at arthritis and looking at the cause of arthritis, there are many different natural treatments. First of all, you can think about topically. There are things you can rub on your
Right.
joints that make them feel better. One would be capsicum, capsaicin, which is a constituent of cayenne pepper, red pepper, and it has been shown to deplete substance P, which is a molecule involved in pain, and it also has an anti-inflammatory effect. So it does a decent job of relieving pain and inflammation. There's also menthol products and various herbal topicals you can put on. But I guess what I usually get most interested is in the cause. Something like osteoarthritis does really well when treated with, one, an anti-inflammatory diet, so eating more fruits and vegetables, more colorful things that contain flavonoids, less red meats, less vegetable oils, and more fish and fish oils, things like that. But also herbs that affect pain and inflammation, like devil's claw or hypogophytum or boswellia, otherwise known as frankincense, or turmeric, glucosamine sulfate, chondroitin sulfate. All those things can really affect osteoarthritis very well. The other thing I found be really effective for osteoarthritis is laser therapy. And it's not something I usually use by itself, although it could be, and there's several studies showing its effectiveness by itself. But I'm usually using it in the context of also, making a more anti-inflammatory diet, as well as some anti-inflammatory herbs and the laser together. And that combination, I've had really amazing results.
And that's the cold, low-level laser?
Cold, low-level laser. It's not the type of laser that, say, is used in surgery to cut things. It's a lower power, so it's not, and it has a divergent beam, so it's not, you don't get the high heat intensities that cut. It has more therapeutic healing effect. Now, when it comes to treating autoimmune type arthritis, like rheumatoid arthritis, it's much more complicated. It's much more multifactorial. There's a lot of things involved in there, but I see patterns, and the patterns I see in rheumatoid arthritis is that a lot of people have a dysbiosis. They have some sort of imbalance in their gut flora that is contributing. You get too much of the bad bacteria and too little of the good bacteria. And those bad bacteria, when they eat up food particles, they produce toxins that are then absorbed and contribute to pain and inflammation. That also has the effect of damaging the intestines. So I often see intestinal inflammation in people with rheumatoid arthritis. And I see that through an intestinal permeability test. They have what's called a leaky gut syndrome. And what that makes you susceptible for is when you have a leaky gut, then things get into your body that shouldn't be getting in. That increases the amount of things your immune system has to deal with, and so your immune system starts becoming overreactive. And you actually become reactive to some of the foods you're eating. And when your immune system's overreactive, then that's going to cause more of those immune complexes that lodge in the joints of people with rheumatoid arthritis. So I look at, is there a dysbiosis? Do they have leaky gut syndrome? Do they have food sensitivities? And those things I very commonly see. The other thing is people with rheumatoid arthritis often have hormone imbalances. They have in some women, they have overproduction of prolactin. They have imbalances in their estrogen, progesterone, and in testosterone and cortisol. So, if the symptoms seem to indicate that, I'll test for that as well.
Well, that's some good information. Thank you very much.
Thank you.